Hello, my name is Andrea Seiler, and I will be presenting a document on a PowerPoint on survivors of traumatic events and the effects of health, as well as how culture affects their health care. Media treats survivors like victims. This can be inaccurate because some of these, most of the time, they are just survivors, or just that, survivors. They are not victims. The media creates inaccuracies, um, and a potential danger because of the perception of the public. There can be misdirected anger, bullying, social isolation, and other factors, which can prevent these survivors from getting the help that they need to overcome grief. Most important factor in developing positive post-traumatic outcomes is social support from family and or friends, or both. Having family support has proven to decrease depression and suicidal ideations and attempts. Friends or peers can also be effective in decreasing depression. That friends can be a shoulder to cry on. They can offer empathy, financial support, point these survivors in the right direction of where to find help that they need, and even, have a friend babysit their children when they need to go to an appointment or whatnot. Also, with families and peers, it has proven to statistically reduce suicide attempts. Cyclic nature is something that occurs over and over again. Every individual handles trauma differently, so they have different responses to their trauma. However, some can show cyclic nature, while others do not. But it has been proven that those survivors of domestic violence have a tendency to get in abusive relationships again, unfortunately. Also, unfortunately, is that the legal systems do not really recognize survivors, for instance, believe in survivors. An example of this is the movement last year when Vanessa Guillen, an Army soldier from Fort Hood, Texas, went missing. Because of her disappearance, her mom had been talking to her on the phone before the disappearance, and she had reported some sexual harassment and assaults. They're not believed. They are not believed in the military. They are not believed in, depending on the area, in civilian factors, which makes it hard to report. For instance, in the military, I know for a fact that survivors get retaliated against, even though retaliation is not a real thing. Or illegal. It still does happen. They feel ashamed. They're victim blamed and given crappy jobs, or even discharged from the military. So it can really affect who reports and why, because of they are not believed legally or politically. Victim blaming is a potential barrier, not being believed, retaliation, gender roles. Men are less likely to report things like sexual assault in the military. Lack of support from family and friends, again, goes to being believed. especially when your family is not the one believing you. Um, you can lose your property, vehicle, homes, etc., because you report or whatever, and those isolations and the lack of resources, especially in areas where there's not a lot of people. Trauma does not discriminate against international borders or ethnicity, race, anything. It's everywhere. Socioeconomic status does not care if you're rich or poor, white, black, purple, green. It's there. Um, so it's everywhere. Low level, lower level of socioeconomic status, they have statistically proven to have a low level of hospital care and an increased risk of death, also an increased disability rate, and they might not seek medical treatment because it costs too much. Minorities are less likely to seek treatment due to not being believed or having biases against them. And interestingly enough, studies have shown that people of Asian descent are less likely to develop problems like PTSD from traumatic events. And those that are among religious um, that believe in religion and seek religion in their recovery are less likely to have issues. However, those that are in a religion that discriminated against sex or um, sex or ethnic people are less likely to report and seek help from their religious outcomes. Gender, women are most likely to experience sexual trauma, while men are most likely to experience trauma such as robbery or being mugged or whatnot, more violent in crime. Well, not necessarily more violent, but less likely to have sexual nature involved. However, are less likely to report sexual trauma, especially in the military, because of that bias and that understanding that if you say something that you are weak and a piece of crap, pretty much. People live in rural areas are less likely to seek treatment because it costs more money, time, and travel to get to where they need to be to seek treatment. And implicit biases are unconscious thoughts that we as healthcare workers can show judgment, such as like if a woman comes into the emergency room for a sexual assault exam, that nurse or healthcare provider may subconsciously think, well, what were they wearing? What were they doing to provoke the problem? And explicit are known biases such as race that people use to discriminate against each other on, and it could affect how, when, and where people seek treatment because they don't want their healthcare providers to have these biases. Again, that being said, trauma has no boundaries. It can happen anywhere to anyone. It is important to educate our patients about resources that they can access to help with their progress, and more effort should be taken to provide health cares for those in areas such as developing countries, so that or rural areas, so that they can get the help that they need.